became interested in Parkinson's disease when my family members, some of them developed movement disorders. In some cases, the diagnosis was clear and it was Parkinson's disease. In 2 other cases, it wasn't so clear. So I began to wonder why that was. And when I began to investigate, I realized that movement disorders are usually diagnosed based on the movement order alone, and this often leads to a high rate of misdiagnosis. I am a researcher, basic researcher, and I study molecular biology. In particular, my specialty is gene expression, which means the study of RNA. And because of my background, I realized that gene expression changes depending on what a person is exposed to in their environment and on the state of their health. And that very subtle changes in the state of their health can be reflected in changes in gene expression throughout their body. So therefore, I thought maybe I could use this expertise in gene expression to look for biomarkers that were gene expression markers. And I thought perhaps I should look at an easily obtained source that was non-invasive to make it better for patients. And so I decided to look at gene expression changes in whole blood. Non-invasive is going after markers that are readily obtained, and most individuals, when they go to their doctor, do not mind giving a test tube of blood. And because of the convenience for the patient, this would be considered a non-invasive technique, and we can collect samples very readily from all the patients when they come in. The goals of my research are to develop biomarkers that would be useful for diagnosing Parkinson's disease. That's the main goal of the project. And in that regard, we hope to develop markers that can diagnose a patient early on. A lot of the movement disorders have a high rate of overlap between the movement disorder itself. And by using these gene expression biomarkers, we hope to be able to distinguish between Parkinson's patients and patients with very similar motor disorders. That way the patient can receive an early diagnosis and receive the best therapy before they go on and have their disease progress. I think that some of the markers we develop will be useful also for basic researchers. And the way that this may be useful for basic researchers is it may lend insight as to the changes that are occurring in an individual at a molecular level and systemically. So if we have a set of markers that all seem to be linked because their gene expression has changed as a group, it may reveal a pathway that we had not realized before was affected in Parkinson's disease. So it may uncover hidden things that we were not aware of that may be quite important. Therefore, it's possible that we may reveal potential therapeutic targets for Parkinson's disease that hadn't been discovered previously. I hope that our biomarkers will help people with Parkinson's disease so that when they get their original diagnosis, they're going to receive the therapy that they need immediately. And the most important thing is they won't receive an incorrect medication based on an incorrect diagnosis. We are developing markers that we can obtain from blood from patients that will be useful in accurately diagnosing their disease and monitoring the progress of the therapy they're receiving so that it will improve their treatment throughout the course of their disease.